Ibuprofen or acetaminophen? What's the difference when it comes to kids? So the simple breakdown is that they're both used for fever and pain, but they're not exactly the same. Acetaminophen, the brand name is Tylenol, can be used for babies as young as 2 months of age, and it's a little gentler on the stomach. Ibuprofen, on the other hand, brand name is Motrin or Advil, can sometimes last a little bit longer, which is helpful for things like teething or overnight fevers, but that can't be taken until 6 months of age. One big difference with ibuprofen versus acetaminophen is that the ibuprofen is an anti-inflammatory medication, so it can treat things that cause swelling, but it is a little bit harder on the stomach, so especially if your child is dehydrated or not eating well, it's really important that you take this medication with food or with a glass of milk to help ease the stomach. Because these two medications are processed in different parts of the body, I often recommend that you alternate between the two if we're fighting some really bad pain or really bad fever. These medications will not treat runny nose or cough. They're only for fever and pain, and then the addition of swelling for the ibuprofen. And remember that the dosing is based on the weight of the child, not necessarily the age. So you always use the syringe or the cup that comes with the medication, and double check the dosing instructions on the package. If you're ever unsure about what dose to use, or your baby's too young to have their weight listed on the package, talk to your pediatrician, or you can always walk into the Over the Rainbow Pediatric Urgent Care if your kiddo isn't feeling very well. Hope you guys have a wonderful day.